Hello everyone, welcome to the series on dental anatomy. This is the first video in the series where we will cover the fundamentals of the subject. So starting with, what is dental anatomy? Dental anatomy can be defined as a field of study that focuses on the structure and function of human teeth. It covers topics such as classification of human dentition, chronology, tooth numbering systems, understanding tooth morphology, study of individual primary and permanent teeth, and occlusion. Normally, humans have a total of 52 teeth during their entire life, of which 20 are classified as primary or deciduous teeth and 32 are classified as permanent or succedaneous teeth. These can further be divided into different types based on their function. The primary teeth includes incisors, canines, and molars, while the permanent teeth includes incisors, canines, premolars, and molars. The incisors are used for cutting food, while the canines help in tearing of food. Premolars help in crushing of food, and the molars are used for grinding. So, to sum it up, the primary teeth includes 4 incisors, 2 canines, and 4 molars in both arches. And the permanent dentition consists of 4 incisors, 2 canines, 4 premolars, and 6 molars in each arch. Now let us understand some key differences between primary and permanent teeth. Two basic points to remember are that the primary teeth are smaller in size and whiter in appearance when compared to the permanent teeth. That is, smaller in size and whiter in appearance when compared to the permanent teeth. Now, in case of primary anterior teeth, the first thing is the mesiodistal width of the crown is more when compared to the crown length. That is, the mesiodistal width is more than the cervico-incisal length of crowns. Okay. The second point is that the roots of primary anteriors are narrower and longer when compared to the permanent teeth. That is, roots are narrower and long. If we see in the permanent anteriors, the roots are wider. The third point of difference is the cervical ridges of enamel. The cervical ridges of enamel are more prominent in primary teeth. More prominent in primary teeth. Next, coming to the posterior teeth, the first point to note is that the crowns and roots are more slender mesiodistally at the cervical portion. That is, in the primary teeth, the mesiodistal distance of crowns and roots at the cervical portion is less when compared to the permanent molars. Also, the buccolingual diameter of primary molars is less when compared to the permanent teeth. Another important point of difference is that the roots of primary molars are more slender, longer, and flared. Longer and flared. And they extend beyond the projected outlines of the crown. Now, this flaring provides space for the permanent tooth crowns to erupt. Lastly, the cervical ridges of enamel. Now, unlike the anterior teeth, the cervical ridges of enamel in posterior teeth are less prominent when compared to the permanent molars. Now, coming to the chronology or sequence of teeth eruption. In primary dentition, both upper and lower teeth follow the same sequence, that is, central incisor is the first tooth to erupt, followed by lateral incisor, first molar, canine, and second molar. Similarly, in the lower arch, we have central incisor, lateral incisor, first molar, canine, and lastly the second molar. In case of permanent teeth, there is a slight difference in the sequence of teeth eruption in upper and lower arches. The first permanent teeth to erupt in the upper arch is the first molar, followed by central incisor, lateral incisor, first premolar, second premolar, canine, second molar, and lastly the third molar. In case of lower arch, the first molar and central incisors erupt almost at the same time, that is 6 to 7 years, followed by lateral incisor, canine, first premolar, second molar, and lastly the third molar. Now let us discuss about the tooth numbering systems that are used to denote the different teeth. Starting with the FDI system of notation that is adopted by the World Health Organization and is also widely used by other organizations. The FDI system denotes each tooth with two digits. The first digit represents the sides of maxillary and mandibular arches, while the second number represents the tooth number for each side. So, the arches are divided into four quadrants for both primary and permanent dentition. That is upper right, upper left, and lower right. Similarly, in the permanent dentition, upper right, upper left, and lower right. In the primary dentition, these sides are represented by the numbers 5, 6, 7, and 8. While in the permanent dentition, these are represented by 1, 2, 3, and 4. Next, in each quadrant, the tooth are numbered 1 through 5 in each quadrant for primary dentition and 1 to 8 for permanent dentition. So, if we get a number 2, 5 represents permanent upper left second premolar. Next, the another system for tooth numbering is the universal system, in which the primary teeth are represented using alphabets and the permanent teeth are denoted by numbers. In primary dentition, the notation starts from the upper right second molar and moves in a clockwise direction towards the upper left second molar. In the lower arch, the alphabetical sequence continues from the lower left second molar and continues again in clockwise direction and finally ends at the lower right second molar. Now coming to the permanent dentition, the numbering here starts from the upper right third molar. So we will have 1 here, then 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and 16. And we will continue in the lower arch from the lower left third molar with the number 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, and 32. So the 3 2 is the lower left third molar. The third type of numbering system is the Zsigmondy Palmer notation system. Again, in this system, the arches are divided into four quadrants. In the primary dentition, the tooths are denoted using alphabets A to E, starting from the central incisor for all the arches. And in the permanent dentition, the tooths are numbered 1 through 8, again starting from the central incisor. Here, we use vertical and horizontal lines to denote the quadrant, thus depicting whether it is a upper arch or lower arch, or the tooth belongs to the right side or left side. So for example, if we have a notation like this saying A, now if we compare this with the quadrant, we can see that it belongs to the lower left side and A represents the central incisor. So this symbol here represents primary, lower, left, central incisor. Similarly, if we consider the permanent dentition and if we have a symbol like this, now we can see that this belongs to the upper left side. So this number represents permanent upper left canine, as canine is the third tooth from the central incisor. One major drawback of this system is that it is difficult to integrate with the computer systems, especially while typing with keyboards. And hence, in 1968, the American Dental Association officially recommended the universal system as the tooth numbering system of choice. So, that was all for this video. Today, we had a brief introduction to the subject where we discussed the classification of human dentition, the chronology, and the tooth numbering system. In the next video, we will continue with the fundamentals of dental anatomy. Till then, if you found the video helpful and informative, then do like the video, share it with your friends, and subscribe the channel for more such informative content.